You went to bed last night feeling completely fine. No chest pain, no dizziness, no warning signs. And yet, while you were asleep, your brain may have been experiencing restricted oxygen flow. Not because of a disease, not because of a medication, but because of the exact position your head was resting in when you closed your eyes. I need you to hear this carefully, because what I'm about to share has nothing to do with diet, nothing to do with exercise, and your doctor has probably never once brought it up during any of your checkups. My name is Dr. Franklin, and over the years, I've spent reviewing cardiovascular and neurological research for patients in their 60s, 70s, and beyond. I've seen one silent pattern that almost nobody in mainstream medicine talks about openly. The way you sleep, the angle of your neck, the direction your body faces, and the position of your spine are actively influencing how well blood reaches your brain every single night. And here's the part that stops most people cold. Stroke risk peaks in the morning hours after waking, with a 49% increase between 6 a.m. and noon, driven by the morning blood pressure surge. That isn't a coincidence. And what happens during the hours before that window? How you sleep, what position you're in, whether your body is properly recovering overnight, directly determines how vulnerable your cardiovascular system is when that surge hits. So before you dismiss this and say, "I've slept this way my whole life," I want you to stay with me, because in the next 18 minutes, I'm going to walk you through 6 sleeping mistakes ranked from surprisingly harmful to genuinely dangerous. And then I'm going to give you 2 evidence-backed positions that could be doing your brain and heart a real favor tonight. But right now, before we go a second further, do me a quick favor. Drop a comment below and tell me, are you a back sleeper, a side sleeper, or a stomach sleeper? I'll be referencing all 3 throughout this video, and your answer is going to matter very soon. Let me give you some context before we get into the list, because understanding the why is going to make everything else make sense. When you're young, in your 20s and 30s, your blood vessels are elastic. They stretch, they adapt, they compensate. Even if you sleep in a weird position, your cardiovascular system quietly corrects for it. You wake up with a stiff neck, and that's usually the end of it. But here's what changes after 60. Your arterial walls begin to stiffen. The small vessels feeding your brain become less flexible. The pressure inside your skull becomes more sensitive to changes in body position. And your blood pressure regulation system, the one that keeps everything balanced, becomes slower to respond, especially at night. Doctors call this overnight blood pressure dipping. Healthy sleepers experience a natural 10 to 20% drop in blood pressure during sleep. This is protective. This is your body recovering. But if your sleep position is wrong, if it's compressing the wrong vessels, restricting the wrong airways, or tilting your blood flow in the wrong direction, that natural protective dip gets disrupted. And what fills that gap is something far less friendly. That's the framework I want you to carry into everything that follows. Now, let's get into the list. Before we continue, tell me your name and where you're watching from. I read every comment, and I'd love to know who I'm helping today. Mistake number 1, sleeping fully flat without any head elevation. Let's start with something that sounds so benign, it's almost hard to believe it could cause a problem. Sleeping completely flat, no pillow, or just a thin one. Body perfectly horizontal, spine supposedly aligned. It sounds ideal, right? But there's a critical piece of the picture that nobody's showing you. When you lie completely flat, particularly after age 60, blood doesn't distribute evenly the way it does in a younger body. In the absence of gravity working in your favor, cerebrospinal fluid can pool. Intracranial pressure edges upward. The tiny vessels in your brain are now under slightly more pressure than they should be for 7 to 8 hours straight. The fix here isn't complicated. It's a 15-degree elevation of your upper body. Mistake number 2, stomach sleeping. This position twists your neck unnaturally. Your neck is rotated up to 90 degrees for hours. This can restrict vertebral artery blood flow. Your rib cage is also pressed against the mattress, limiting deep breathing. Lower oxygen and restricted circulation happening together can create cumulative strain over time. Mistake number 3, stacking multiple pillows. Too many pillows force your chin toward your chest. This compresses arteries and veins in the neck. It can reduce blood drainage from the brain. The result? Morning headaches, brain fog, and heaviness behind the eyes. The solution is simple. 1 properly contoured pillow. Mistake number 4, right side sleeping with cardiovascular history. The heart naturally sits slightly left of center. Sleeping on the right side may alter blood return to the heart. For people with existing cardiovascular strain, this can increase workload overnight. Mistake number 5, sleeping in a tightly curled fetal position. This compresses the lungs. Breathing becomes shallower. Blood oxygen levels may drop. Circulation through hips and knees can also be restricted. A small adjustment, like using a body pillow, can help dramatically. Mistake number 6, late eating and alcohol before bed. Large meals redirect blood flow toward digestion. Alcohol disrupts normal nighttime blood pressure regulation. Together, they can interfere with overnight cardiovascular recovery. Finish eating at least 3 hours before bed. If drinking alcohol, stop 4 to 5 hours before sleep. Now, the 2 best sleeping positions. Position 1, left side sleeping. This supports better circulation. It reduces pressure on major blood vessels. It may also support the brain's overnight waste clearing system. Use a body pillow if needed. Position 2, back sleeping with 15 to 30 degrees elevation. Use a wedge pillow or adjustable bed. This reduces intracranial pressure. It improves airway openness. It can support healthier overnight oxygen flow. Your sleep environment matters too. Keep your room cool. Limit screen exposure before bed. Reduce noise. And if possible, monitor overnight oxygen levels. Here's what I need you to remember. Your risk of stroke doesn't disappear when you fall asleep. The hours between midnight and dawn are critical for cardiovascular recovery. And your sleeping position is something you can control starting tonight. Pick just one change. Switch to your left side. Elevate your upper body. Stop eating late. Use one proper pillow. Small nightly changes compound over time. Sleep smart. Protect your brain. Take care of yourself.